Hello and welcome, everybody. Thank you for being here today. We're delighted that you could join us. We're broadcasting live from Park City, Utah, where I am. Doug, where are you?
I'm in Menlo Park, California.
Menlo Park, California. Rich?
Columbus, Ohio.
Columbus, Ohio. So welcome. Thank you all for being here with us today and spending some time this afternoon. I have to give my friend Jennifer Fearon all the credit for introducing Family Office Insights and me to the folks that are going to be on the call today. So thank you, Jennifer. Christian's on the call too. So thank you, Christian, for all your work and getting this going. Big thank you to the Family Office Insights community for being resilient through all the COVID business and being active and joining us in these webinars. And we're so glad to have you. So just a little Zoom housekeeping. As you know, we can't hear or see you. And in that we have a limited amount of time today. While we're doing the presentation, please feel free to post your questions in the Q&A or the chat box as they come to mind, and we'll get to as many as we can. We have a formal presentation, but don't feel like you need to wait to ask the questions. We'll be monitoring them as they come in. We also, as a matter of record, are going to be recording this. So I'm just smiling because I saw something come in. The recording will be posted to the Family Office Insights YouTube channel, and you can revisit that to watch it at your leisure, as well as you're welcome to share it with others that you think will benefit from learning about what we're going to be talking about here today. One of the things I'll mention before we get started is this fund has a unique nexus of connectivity to the AMA, which is fascinating, and you'll learn more about why that is. And while healthcare represents 18% of the GDP, there are things that we can incrementally do, which is will be demonstrated here today in this fund to help along the massive amount of inefficiency in the system. So with that, I'm going to hand it to Doug. Doug, welcome. Take it away.
Thank you. Hey, well, I'd like to welcome all of you. Thank you for giving us an opportunity to let you know what we're doing. I'm joined today by the investment partners for the fund and also one of our key LPs. Thought it might be helpful to hear from one of the LPs. He'll be joining the LP advisory committee as well, and why he maybe decided to do this. But at any rate, we're delighted to have this opportunity to involve you guys, and hope you join with us. With that in mind, I'd just like to start by giving you some outline of the presentation. I'll kind of foreshadow where I'm going. I've got 4 chapters where I'll talk about the history of where we came from, what we're trying to do, who the people are involved in our resources, and then I'll talk a bit about the investment strategy and the portfolio to date, and finally the investment terms. So that's about 15 minutes of me, and you can interrupt at any point that you'd like. So the first slide's really key summary points, and the need in healthcare is just tremendous. 30% of the healthcare expenditures are probably waste. It's $4 trillion a year, and something like 75% of the spend is now directed towards chronic disease. And the system isn't built and set up to really prevent and manage that kind of connected, continuous care that reaches out into the community. So we formulated a response asking, what should healthcare look like in 2050? And what are the big system level changes that need to occur? And what can we organize to be addressing those? And that was important to us because we just didn't feel like, the world needed another healthcare venture capital fund. It didn't make sense. But if it were unique and it had a real edge, a real competitive advantage, and healthcare is such an insider's game, you just had to have an unfair advantage, or we just didn't see the opportunity. And in having this conversation with the American Medical Association and its transformative leader, Dr. Jim Madera, who's been there about a decade, he thought the vision was just fantastic. We've gone on. The third thing I'll talk about will be, really execution, and then the results. Go ahead. So first thing, let's talk about timing. The market is broken, has a bunch of pain points. We know that there are many issues of access and affordability, and cost and value, huge disparities that, were just, on the stage throughout the COVID situation, and society just isn't sustainable with that kind of healthcare delivery. So we felt that there were a number of really key issues that we could address. There's the bias towards acute intervention. There's addressing a need for, a better physician-patient interaction and engagement, problems with reimbursement, driving overutilization and poor outcome and value, cybersecurity issues, complex regulatory environments, on and on. You're aware of all these, I would think. So that then brings us to Health 2047. Working with Jim Madera, he wanted to take what the AMA knew and do more with it and make greater impact. And to do that, as we conversed 6 years ago, we said, well, why don't we put in place an innovation ecosystem and really work on these system level issues? But to do it at scale, you've got to have the most important industrial partners working with you. And whether they are, in the payer realm, in the provider realm, the product companies, the technology companies, the retail and consumer, we needed to basically work on convergence and work on the difficult white spaces between them. So Health 2047 was formed to do that. And it felt the most powerful way to do that was to form new companies and to capitalize them. And the AMA, has wonderful, influential contact with the 1 million or so US physicians. It is in a position to really communicate and open those channels. United Health Group, as you'll learn in a minute, is probably the only national scope health services company out there, both insurance and care delivery, and certainly data with Optum. So at any rate, that strategic group, together with us, accelerates the opportunity for portfolio commercialization, network effects and channel, opinion leader access, credibility. And as long as we motivate those senior managers and those organizations to participate, it's really up to us to do that. And you're going to see in a minute how effective that's been. The AMA rolls up the 190 or so medical associations in the country, and 99% of the physicians in America belong to one or more specialty or state medical society. And so that's where the reach comes from. And it's there's a number of businesses that the AMA operates as well. Just wanted you to understand the scale of that organization. Something like 1,100 employees, 1,000 at headquarters in Chicago, 100 in Washington. And they have about 450 million in annual revenues from products and services that they provide into the healthcare economy. And they've got approaching $1 billion capital endowment. So for a not-for-profit association, they're really strong, and they're really big, and they've been in business for 170 years. So, that's what we're getting from that relationship. United Health Group, equally impressive. They're a member of the Dow 30, of course. They're Fortune number 5 in terms of revenue in the US, and in the top 10 internationally. And their rate of growth has just been stunning. They're obviously meeting needs and being a diversified healthcare services company. A lot of people think of them as the insurance business, United Healthcare, but that's just one of the subsidiaries. Optum is probably the most powerful business process outsourcing and data enterprise in healthcare in the US. So having them and access to their senior management, their venture group, and their corporate research has just been marvelous for us. All right, so the next slide is just a quick historical perspective.
Hey, Doug, I think you might. I just wanted to ask, and I think it's instructive, and you may be getting to it now, but in that you had a role in the Health 2047 prior. It's not new to you what their objective and interests are. Did I
That's
read
right.
that
Okay.
correctly?
You did. You did. Well, why don't I background that a little bit for the group? You know, it's, I know we've got kind of diverse backgrounds. So I, the way this all happened is, you know, I spent a decade in academic medicine at the University of Chicago and at Harvard and Mass General Hospital, and fully trained in infectious diseases, internal medicine, and virology. Imagine, you know, having all of that background just as we rolled into COVID. I then went into the pharmaceutical industry and led global research management over the next decade at a number of leading firms like Eli Lilly and Schering-Plough. And then after formal business training at Wharton, went off and founded a biotech company in 1993 and took it public in 1997 with Fred Frank and Lehman Brothers. And that was the first of 5. So I was the CEO of 5 biotech companies and life science companies. 3 of them were public and 2 of them I took public. And that decade was really a whirlwind, and those were all venture-backed companies. So I then moved to the other side of the table and did 15 years of full-time life science venture capital investing in Silicon Valley at Bay City Capital. And during that period of time, I chaired the visiting committees at the University of Chicago Hospitals, Medical Center, and Medical School. And the dean and CEO of the health system was Jim Madera, who later went on to be the current CEO of the AMA. So we had that working relationship. And when we talked about how the AMA could really make the kind of impact that he felt they could, the idea of inventing Health 2047 came about. You know, remember I said our goal was, what should healthcare be in 2050? And since 2047 is the 200th anniversary of the founding of the AMA, and to date they've put $120 million into our business. We thought that was a great name, and it was a tip of the hat. So that's where that came from. So that's kind of the second column here of 2012, his strategic plan. Third column was our introduction and working together to stand up Health 2047 Inc. And I was the founding CEO and ran it for the first 3 years. But we realized that to capitalize on the opportunity, we needed more capital than simply the AMA could provide. So we formed a venture capital enterprise, and that's what you're seeing today, Health 2047 Capital Partners. But it's part of the continuum of what happened starting in 2014. And once we decided to put it in the framework of a venture capital fund, United Health Group felt they could invest, and they wanted to be pari passu with the AMA. And the reason for that is the strategic vision for healthcare that the AMA brought forward was so close to the strategic plan of United Health Group as they looked forward, that they felt that having sort of a non-view strategically through the AMA lens and being aligned with that would be invaluable to them as a strategy input. So that's how that came about. So on to the next slide.
And so the 120 million, just to be clear, was invested by the AMA into 2047 or the venture fund?
Both. So I've just put up a slide, Art, which is showing sort of the history of the financing starting 2014.
Got it.
And you can see for the first 3 years, it came from the AMA, though one of the first companies we stood up called Akiri in data sciences was compelling to the chairman and CEO of Celgene, and they put 15 million into that Series A. That was early, and that's when we realized that if we had access to more capital, we could really supercharge these insights that we had. That takes us into the middle part of the chart, and it simply says that United decided alongside AMA to fund the fund, and they each committed 30 million to Capital Partners. And so back to the 120 million, 90 million has gone into Health2047 Inc. from AMA. 30 million has been committed to the fund by AMA. That's the 120. United has committed 45 million to the two enterprises, with 30 million going into capital partners. And that brings us up to the current situation. We went out then and raised another 35 million in this fund from institutions and family offices. And now we have received a commitment to add an additional 15 million from each of AMA and United Health. They'll match whatever we raise, which is fantastic. So if we can raise another 30 million in the course of the next couple of weeks, they will match that. In other words, it'll be 60. And given the dynamics going on in the investment world in healthcare and digital health in particular, this is the opportune time from an ROI point of view to be taking equity positions in these very promising companies that are having these liquidity events and exit events, very high valuations and very early in their life cycle. So that's it for this slide. Did that, do you want to, does that kind of handle that for you?
Super helpful. What's the overall raise objective number?
So we have 65 in the fund. We'd like to add another 30 million from additional investors. That'll be matched by 30 million from AMA and United. That would put us at 120. The fund is labeled at 150. We have the capacity to go to 250. And as you know, there are a number of institutions that are just so big that
They need to write a big check. Yeah.
Yeah. United was 30 million and AMA was 30 million.
Yeah.
Okay, so that's kind of
super
chapter
helpful.
one. Okay, chapter two is about the people. And now I have 5 slides that introduce you to really 45 people. I wanted you to understand the breadth and the depth of the resources that this fund is orchestrating. The first slide shows the 4 investment partners, and I'm joined on the call today by Rich Langdale and Gary Cookhorn, raised in London. We are all very experienced and successful investors. And we come out of, I'm going to call them adjacent and complementary spaces. And we've all known each other and worked together for more than 20 years. So the idea here was let's be sure that we supercharge the management team for this fund as we get started. And Larry, shown on the bottom, is the CEO of Health2047 Inc. now. He's the second CEO after me. And he and all of his resources are available to us because we've given, he's part of the GP. And he's a wholly owned subsidiary of the AMA. So that's how the AMA would look to recoup some of the 120 million investment that they put out there already. So we really want to build a sustainable, self-financing, perpetual fund vehicle, a series of vehicles, and that's what we're up to do, and we'd love to have you join. So that's the first slide on people, and we're the key investors. We have about 20 advisors available to us through the Health2047 group, and I just selected 4 of them to illustrate the nature of these people. And I would say, Cheryl Whitaker is a 2-time CEO in the Medicare and Medicaid space, lives in Cook County. Her husband was the director of public health for the state of Illinois, deeply committed to health disparities and difficult zip codes. Eric Blanca is the dean of the chief innovation and chief information officers in the healthcare space. He just stepped off 6 years as the CIO for the Stanford Health System and the Stanford Hospitals. Before that, he had the same role at the University of Chicago Hospitals. 35 years as a CIO and just a tremendous strategic leader. Judy Barkle, same altitude, was a global partner at IBM Consulting and of course, healthcare focused. And she's a managing director at Health2047 Inc. Charles Onger is the chief technology officer for Health2047 Inc. And he worked for the Crown Prince of Abu Dhabi and built the Cleveland Clinic the technology background for the Cleveland Clinic Abu Dhabi, which was the first major hospital, 400 beds, that was 100% paperless the day it turned on its lights. So examples, but later I'm going to show you just another snapshot of people, but these are exemplars. They are all compensated, they are all committed. And when you go on the website of either our website or health2047.com, you can background all these people. Next slide, please. So Health2047 Inc. has a board, and the chairman is Jim Madera, the CEO on the top here of the AMA, and his number two, Ken Sherrigan, the chief strategy officer. I'm on that board, and as is the current CEO, Larry, and as is another one of the partners in Capital Partners, Ray Bingham. And Ray and I run the investment committee for Health2047 Inc. And essentially, their startups are usually too early for a venture round, but it's like the farm team for us, and it gives us a right of first refusal for all of the companies that they found and form. And that's led us to co-invest with them on 2 of their 9 companies so far. So again, some of the special sauce and the edge that we have in terms of access to what I would call some of the hottest deals. The next slide. This is Larry's managing directors, and he has another 10 or so subject matter experts. He has executives in residence, venture partners, and he has the CEOs of the 9 companies he's formed. He's got 7 other companies in the hopper that he will incorporate and form most of those over the course of the next 12 months. And each of them, of course, have a CEO. So he has a large stable of really talented entrepreneurs. And all of these are available to us at Capital Partners for diligence, to sit on boards for us, to be advisors to what we're doing. And it's just an embarrassment of riches. The next slide. And these are the advisors I was referring to. And again, you can just tell by the age and the distribution and the diversity of the group that they represent a tremendous resource that we've curated very carefully over the course of the last 5-6 years. And this doesn't even include the 12 senior vice presidents that run the various divisions of the AMA, who are love coming out to Silicon Valley, love interacting with us, provide support to us, and channel strength whenever we want to reach out to the parts of the medical environment that they all manage for the AMA. So those are the 5 slides that talk about the people. And this just is a snapshot of the wonderful relationships that we have through these people. And we leverage all these relationships, and they represent among the finest healthcare systems, technology companies, the venture capital ecosystem nationally, the retail, the payers, the providers, on and on, and certainly the product companies. So, we have ready access to the C-suite and the board of all of these organizations. And that's part of the unfair advantage I'm talking about. And if you want to be in the rigged healthcare investment game, you've just got to have this kind of, this kind of access. All right, so that's kind of the second chapter I wanted to talk about. The third one is shorter. I just wanted to tell you what our investment approach is and our investment strategy. And the investment approach starts with the strategic arcs that the AMA as an organization feels are the most important system level initiatives that need to be addressed for the future. And they're shown on the left. And when we translated those into investable concepts, we came up with pillars. So these are the areas we do invest in and the areas we don't invest in. So we've made a conscious decision not to invest in drug development, drug discovery, and biopharma or devices. And that's because of the capital intensity and the long periods of time it takes for them to get to market. And that is a pretty saturated investment vertical. So we do just about everything else. We do data, we do chronic disease management, we do productivity, and we do value. And I'll just quickly define what those are on the next, on the slide we have here. So anything to do with data access, data rights, data liquidity, data interoperability, intelligent data is what that's all about. And we're forming companies that do that. Chronic disease is a huge spend now. And, a lot of that doesn't get its care inside hospitals. And we have all this bricks and mortar in our healthcare system. And we're learning how to distribute that care, have it be coordinated, use technology to enhance it. And both the prevention and the management of chronic disease in the community, in the home, and outside of the hospital in ambulatory settings. So that's just so ripe for innovation and disruption. And the ROIs available, if you get these models right, are really startling right now. Productivity is, efficiency. It's how to use artificial intelligence, machine learning, telehealth, remote patient monitoring, virtual care, things. I'm trying to pick things that you've heard of and you're aware of. And we've founded a number and invested in a number of companies in the AI space in particular. And then finally, value is, reinventing insurance models to be sure that we're getting the value for what we're paying for and we're getting better outcomes. And these problem statements below each of these four pillars are the intellectual contribution of those 45 people, the AMA, United Health, and the four investment managers. And we figure if we define the problems right, our prospecting and our place selection and investment is going to be very special. And that's what this slide is all about. And, we could go on and on about this. And I think you'd really find that most things you think about in healthcare would be reflected here. And you'll see it in our portfolio. This shows the momentum of company formation that's occurred as we've deployed the 180 million so far. And you can see the first company was formed in 2016. I mentioned Akiri, and Celgene put 15 million into that. We next founded 2 companies a year for 2 years, and now we're running at 4 to 6 companies a year, and that'll be our baseline. The earlier ones are, staffed and put together and built and financed by Health2047 Inc. And when they are mature enough to be targets for venture capital, and we can see the liquidity and exit back end of these, we then come in with capital partners and participate. Next slide. So there are now 4 slides that I don't want to present. They're sort of there for you to check out. And they represent, first of all, the 7 investments that have been made by capital partners on the first 2 slides. And then the third and the fourth slide are the 9 investments that have been made by Health2047 Inc. And recall, I've referred to those as part of our deal flow. We get our deal flow from many other places. We get them from United Health, we get them from AMA, we get them from venture capital firms, from entrepreneurs. And just the last thing I want to say about the portfolio is that, we have a deep strategic imperative to deal with health diversity, equity, and inclusivity. And, people have been slow to recognize its importance in American society and healthcare. And I wanted to point out here that we're both founding and investing in companies who are principally advantaging these disadvantaged groups and doing that at, for profit. And also point out that we're supporting some of the most interesting, diverse, and talented CEOs. Sushi Saria on the top is one of our portfolio companies that we did with Andreessen Horowitz at Capital Partners. And Serena Williams just came into that because she has a chronic disease, pulmonary embolism. And this is a patient deterioration machine learning platform that uses Bayesian statistics and came out of Johns Hopkins. And she is one of the 10 World Economic Forum 40 under 40 superstars in AI. All of her computer science background came from Stanford. So at any rate, that's Sushi. Eric Whitaker, terrific guy, Cheryl's husband, he founded Zing Healthcare, and Zing is providing Medicare Advantage plans in distressed zip codes. Started in Chicago, Cook County, working in Milwaukee, in Detroit, and is rapidly expanding. He's just merged with a company that has licenses, I think, in more than 30 states. And so they're in the enrollment period now for MA plans. And that has a $200 million investment. After we founded this, a $200 million investment from a fund related to the George Soros family office. And, Gary Cookhorn's on the horn with me today, and he's just has a tremendous background as an investor at Fortress Investment Group. And before that was notable because we were classmates and in the same study group at Wharton 30 years ago. He went on to spend a decade at the World Bank and a decade at the UN in finance functions before he went to Fortress. I was so grateful when he came over and leaned in to help us. So those are the 5 or 6 slides that relate to the human resources and the wonderful relationships that come with them.
So Doug, when you said we founded it, the company, for example, is you funded the founder and therefore you were a seed investor in that company?
Yes, and you have founder stock and obviously preferred stock in the business.
Right.
So I said that with respect to Zing, and the 3 initial board members for Zing were Eric, Larry Cohen, the CEO of Inc., and me. And when it came time for the investment, Larry took that investment, and I stepped off the board when the Soros fund came in at scale, because it was kind of an interesting thing. The United Health Group thought that it was directly competitive with one of the most important growth channels for their business, the Medicare Advantage platform, and they asked us just not to create that conflict. So that's Larry's investment. He's had an 8x return in his most recent investment, from the first investment to this investment, cash on cash. So, it's a really going to be a high flying, big exit, we think, and we'll all, benefit as an ecosystem, though it's not in the fund itself.
Got it. I was just trying to be clear about it. Is you help found the company by funding it as opposed to being a co-founder, right?
Right.
Yeah.
Larry's charter requires him to be a co-founder of the companies that he, incorporates, and that's just part of his charter from the AMA trustees. We don't have any of those limitations. We can invest at any stage, and as you'll see in the next 2 slides, we do.
Yep, got it.
So these are the last 2 slides, really, and they just introduce the investment terms and objectives. And I don't think I can read it on this slide. Give me 2 seconds. I'll just take it so we're looking at the same thing. So we're stage agnostic, meaning we'll invest in a Series A or a B or a C. In fact, we've even gotten an investment in a Series G in our portfolio. We would like to have 10 to 15 investments in the portfolio, and it depends on the ultimate size of this fund, which we'll know very shortly. But typically, you wouldn't have a concentration of more than 10% in most of the 10% of your capital in most of the companies you would invest in, though we have the opportunity to go to 20% in a couple of them if we choose to. We always drive for intellectual property protection when it's available to create sustainable competitive advantage. And on the adoption side, we're a real juggernaut because of the channel strength we have into the physician community and certainly into the installed base of United Health Group. From a risk mitigation point of view, we're working on 4 pillars. We're not just doing digital health, for example, and I explained that earlier. And we're also diversified by stage. And this laddered portfolio, you'll see in the 7 companies that we have in place so far. We've got fantastic deal flow, and I think in our experience, one of the larger risks to funds early in their life cycle, fund families, is the ability to get into hot deals, the ability to see them, to be able to participate with the most important co-investors, and the correlation of returns, of course, go with those investors. And we're enjoying all of that. And right now, we're just dying to be able to deploy more capital into equity positions in these investment opportunities that that we have warehoused. Right now, we're working on 6 or 7 in the fourth quarter, over and above the 7 investments we've currently got in place. The next slide. So basically, it's the cover sheet on the commitment size is we said we're seeking 150 million. We picked that together with the CEO of United and AMA, and we said, 100 is probably not enough. 150 is probably about right. Let's run with that. But they both agreed we can go further if we want to. Hang on, something happened. Oh, an incoming call. The investment period is 7 years, and we're in the early part of the 4th year of that. So 3 more years to go on the investment period. The term of the fund is 12 years. And we started in April of 2018. We will invest typically 5 to 10 million would be our bite size, but that's in the entire life cycle of the investment. So figure we usually plan on 3 investments, a Series A, a Series B, a Series C. So, 2 to 3 million per round makes sense for us. If the fund increases to 120 million, we would increase that size probably to closer to 10 million set aside for each investment. We have an appetite for a very high return on investment. We'd like it to exceed 20% IRR, and we'd like the multiple of invested capital to exceed 3.5x cash on cash. That's the goal setting. That would end up with a net that's greater than 3x cash on cash. So we've set our sights on that, and I think when we have demonstrated what we're able to accomplish with this fund, in the future, then we would look to succession planning and an additional fund and leave that as a perpetual sustainable, resource for the AMA. So that was my last slide, though I do want to come back and talk to you a little bit about a couple of the great investments, but there might be questions first. So listen, the last slide is the same as the first slide, and it's basically the key summary points. Now's the time to be attacking the healthcare needs and pain points, and the capital markets are just on fire. It's I don't remember a time when I was as enthusiastic about being able to deploy capital in my 20 years in the venture community. The response we put together with Health2047, the AMA, United, and Capital Partners, you got to see the breadth and the depth of the resources. You also got to see our execution. You have this huge advantage coming in at the back and seeing what the portfolio is, and you're buying a portion of each of those companies through your investment, and they're that much closer to their exit point. And so, you can think that through yourself, but I think it's highly attractive and quite unusual to have this kind of opportunity at this point. And in terms of results, I'm going to talk about 2 companies, and then I'm finished. One is Olive, and Rich Langdale was involved in Olive early in its life cycle. And Rich, if you just talk a little bit about that and our 2 investments.
Yeah, thank you. So Olive is a company that's attacking inefficiencies in healthcare using artificial intelligence, and they work with now hundreds of providers, healthcare providers, mapping out their workflow and looking for areas that you could replace people with an artificial intelligence process. And we used to think of that maybe society as a bad thing, but in healthcare, one of the biggest limitations we have is availability of physicians and healthcare workers. And so it's an absolute necessity for the hospital systems to be looking at ways to have their time more efficiently being spent with patients, creating better patient outcomes, and not typing and retyping documentation into systems. And so they went straight on against that problem. We're seeing dynamic growth. Their valuation just hit $4 billion on their last $400 million capital raise, up about 3x from where we invested. at Health2047 Capital. And they're just getting started. It's one of those companies that you don't have to squint too hard to see, $100 billion type of valuation in the future as they look at, the $1 trillion of waste that Doug mentioned earlier that they're going after.
And Rich, the key investors that we were able to join on this.
Yeah, there's a lot of great investors in this. Most of the larger investors across the healthcare system have now participated in this round, and they were on that list earlier that you showed, Doug.
Right. That's great. Thanks. And just to pick a second one, why don't you just handle that as well, Rich? I like to talk about Chapter and the potential interactions with the AMA.
Great. I think Chapter was a great example of how the AMA works, and also an example of an earlier stage business. Olive will probably do $100 million in revenue this year. Chapter will do closer to $1 million of revenue this year, but did just close around at a $350 million pre-money, $42 million raised, which is about an 8x improvement from where we invested as a fund. And a lot of what created that incremental value was our ability to help from the AMA. So what do I mean by that? Chapter is in the Medicare bed sup business. What they've done is they've built a way to take every single available plan and put it into a sophisticated database and process that allows either a healthcare resource manager, an HR director, or an individual to find the plan that best suits their needs. So, maybe that's most efficient. Maybe it's the right type of prescription drugs, varying by location, varying by needs, varying by age. All of that is sortable and addressable in their database. We brought that to the American Medical Association, who actually supplies this service to healthcare industry participants, physicians themselves. And so they're very knowledgeable about the product and services that are available, and it would be important to them to be able to select and find the best ones. And there's tens of thousands of policy members there. And if you extrapolate that, it created a lot of value for the Chapter organization, which we're still just beginning to unlock. So we think we're at the rocket ship on the launch pad right now there.
So, Rich, just to be clear about the business model for Chapter, it's the provider that's selecting which ones they're most likely to accept.
So it is
as a provider.
Is every available policy there, and then an individual or a lot of our customers are corporations that are helping their associates find the right policy for themselves.
For the consumer, yeah.
Right, for the consumer themselves, or in the AMA's example, the AMA is helping physicians find the right policies for their needs. And again, there's thousands of physicians a year rolling into a program like this. So they will be the toolkit that allows them to make that selection more efficiently.
Got it. Super helpful.
Thank you.
Arthur, I was going to, thanks a lot, Rich. Chris, if you're on mute, and if we can get you in here, I'd like to introduce you to the group. Chris Anzalone is the CEO of Arrowhead Pharmaceuticals, NASDAQ ARWR, and he is a substantial limited partner with us, and actually will join the LP advisory committee because of the scale of his investment. He and I have a long working relationship, and I just wanted to let one of our LPs who's betting on us tell you what it was he liked about it.
Okay, thanks, Doug. So I have nothing prepared, but I can give you a quick snapshot of what interested me here. So I've known Doug now for a bit over 10 years. I've known of Doug for probably 20 years. So I don't know how familiar this group is with the healthcare system, but it is shockingly convoluted. And I think the most lay people will accept that, but I don't think they really understand it. It is shockingly convoluted and complicated, and so that of course presents a number of opportunities, but there's a big risk in that knowledge, right? There are very few who really understand how the system, as convoluted as it is, works. So if you're going to invest in a fund, at least from my perspective, if I'm going to invest in a fund, it's going to have to be unique. And so there are three big reasons that this made a lot of sense to me. Reason one was the AMA, reason two was United Health, and reason three was Doug Given. Between the AMA and United Health, there is no more complete understanding of this convoluted system. End of story, period. And then with Doug, I don't know an individual who has a more complete understanding of the system, from therapeutics to provider to payer to data and beyond. And then you overlay on top of that Doug's network. Again, I don't know anybody with a broader network in this field than Doug. It's funny. There is an annual conference in San Francisco in January every year. It's put on by JP Morgan, ostensibly. However, there's a number of pilot fish that then glom onto that. And so literally everybody in healthcare is in San Francisco for about a week in January. And I've been there with Doug in the past, and you can't walk down the street of San Francisco with Doug during that week and not be stopped, a dozen times. I say that because it's important. Between the knowledge of and the experience of AMA and United Health, if you add somebody who's on the ground and knows that system like Doug, it's just invaluable. So this fund had all of that, and so it's unique. Look, I'm just a guy, and it's a unique opportunity, to invest in a vertical, with really the class in that vertical, and so it wasn't something that I was going to miss. And so with all that, the fund, at least from my perspective, seems to have the things that you need, right? You need, in broad numbers, four things, right? You need to be able to identify problems and opportunities. And that's hard in healthcare. It sounds easy, but it's not, because it's so complicated. Second, you need to have access to solutions. Again, between Doug and his network and the AMA and the United Health, there's nobody who has access to more solutions, I don't think, than that group. Third, you need the ability to execute. I've seen that in Doug over the last 15 plus years. I'm not worried about that. And fourth, you need ability to finance. That's where the fund comes in, of course. But they're going to need to work with other funds, and because of the AMA and United Health and Doug, I'm confident that they can do that. So this was a no-brainer for me. I feel privileged to be included or allowed to invest in this, and I look forward to seeing how they do.
Thanks, Chris. There is a disclosure here. We looked at Chris's company 10 years ago at Bay City Capital, and I was the partner evaluating. I proposed it for an investment, and it didn't make it through the investment committee. And I got permission to go on Chris's board because he made an invitation. And 10 years ago when that happened, it had a market cap of $15 million. Today it has a market cap over $8 billion. And we've been working together. I've been on his board, actually chair of his board for those 10 years. And he's just, as fine a CEO and fundraiser as I've ever met. So he had choice and he chose us. And I appreciate those comments, Chris. Looking forward to working with you on this fund.
It'll be great fun. And I'm happy to answer any questions that anybody may have.
So thanks for joining, Chris. It may seem obvious to those of you that are knee deep in how convoluted the system is and how complex. Is there a threat in your view in our lifetime that there's going to be a change in healthcare being provided, like it's attempted to do several times from a regulatory and government perspective? Is that worthy of being dismissed, or is it a real threat? Single payer system, government provided healthcare, all that sort of thing.
Yeah, I think it's an and. we certainly have to have healthcare accessible to everybody. And we haven't gotten that done. And I think there's a role for government. It probably is government's role for a basic safety net that gets that done. And the return on that investment will be enormous for the productivity and the GDP of the country, because healthy people produce goods and services. And that's the way I see it. Given our culture and our traditions in the U.S., I don't see a single payer system. It's just not compatible with, with a free market system. So I think it's always going to be a hybrid. But Art, you got to realize, of the 300 and whatever it is, 50 million Americans, half of them, 150 or 60 million, are already receive all their healthcare insurance from the government, Medicare, Medicaid, the VA, the military system. So, and the chip system for children. So we already have a hybrid system. There's ebbs and flows about what's the best way to get more value. And what I'd say is 4 or 5 years ago, McKinsey did a study of the digitalization of industries in America. And they looked at 21 industries, and healthcare ranked 19 out of 21 in terms of its productivity related to digitalization. Really a big laggard. And one of the reasons I have so much optimism about more value and better outcomes, through information systems and the like, is that finding. So as we
you only can go up, right? You only can get better, presumably. Did I lose you?
No. I was,
Go ahead.
I don't learn anything when I'm talking, Art.
No, I think there's a little bit of delay, but it's what you just said. There's nothing but opportunity to go up from 19.
Yeah.
Yeah.
Yes.
Yeah.
And in fact, that's why we placed the business, in Menlo Park, because we looked at Boston and Chicago and Austin and up and down the West Coast, but we thought the highest concentration of innovation in information technologies was in the Bay Area, and there's a very large healthcare community and ecosystem here as well. And we just thought we could have gone to a lot of places, but we chose it for that reason. See if we couldn't pick the lock.
Yeah, totally makes sense. So we're going to put everybody in touch with you and vice versa, and we're going to help catalyze this raise. The Family Office Insights community knows that we generally don't have any skin in the game, and the only skin in the game we have here is helping you with this mission because of our friend Jennifer, just to be super clear. The due diligence, we have a compressed time frame here simply because you're running hard and fast. So if people were interested in getting knee deep and looking at the due diligence even further, there's a data room and that sort of thing, Doug?
Yes, absolutely.
So that's available to everybody?
Yeah, we need confidentiality to go into the data room, though.
Of course. Yeah. So we're going to make sure that the people on the call get the information from you, and then we'll make sure that we follow up with them directly along with Jennifer and Christian. And this has been super, super interesting. It's a daunting task, but seemingly ripe with opportunity for investors and to innovate and take some of that friction out of the system as well. So I really super appreciate you guys being here today. You want to close it up, Doug, with a final comment?
I just want to thank everybody for investing your interest in us. We'd love to have you join us. He's right. We just have got a number of days left. From the standpoint of diligence, United, AMA, Chris, the institutions that have come in, all of that is, that's borrowed landscape for you. You may have some areas of particular interest, but you won't find any background checking or issues or anything at all of concern.
Lots of green lights.
That's right. So I'd encourage you, if you're interested, join us, and we're going to keep pushing capital into these really, really promising companies in this environment with the rapid value creation that everybody is seeing.
Yeah, the timing is right. There's no doubt about
Thank
it.
you.
Great. Thanks, everybody, for being on. Rich and Chris, thank you for joining. And Gary, thank you for helping us along here. And nice to see you. And to everybody on the call, thank you for giving us the only thing you can't make more of, and that's your time. Until next time. Thank you.
Thanks,
Thank
everybody.
you so much. Bye-bye.